AG is a 7-year-old female with hypoplastic right ventricle, hypoplastic tricuspid valve, a detransposition of the great arteries, and a restrictive VSD. She's status post hybrid procedure with a PDA stent and bilateral pulmonary artery bands placed 6 weeks ago. She has been transferred from the NICU to PCICU 3 weeks ago with concerns for hypoxia, a trend lowering of her NIRS, and greater oxygen requirement. She remains in the PCICU for medical management as she awaits her NORD procedure that's scheduled for next week. She has no other past medical history. Her complex congenital heart lesion was diagnosed in routine 20-week anatomy scan, and she was born via scheduled repeat C-section at 39 weeks gestation. This is the parent's first baby. Prenatal history otherwise was unremarkable. In the last 24 hours, AG has had higher oxygen stats in the high 80s with concerns for pulmonary overcirculation. She's also on an milrinone infusion to support her cardiac output and a high flow nasal cannula, and has since been tolerating advancement of NG feeds and growing. Current weight is 4.15 kilos. She did have her Hep B immunization, the first dose, shortly after birth. No other immunizations at this time. No known allergies. Vitals in the last 24 hours. She's been afebrile, 36.2 to 37.1. Tachycardic around the 150s to 160s. Normotensive, her blood pressures have been at goal between 60 to 80s over 50s. And her oxygen saturations, while on 30% FiO2 of high flow nasal cannula at 6 liters, has been in the high 80s. She's been tachypnic in the 60s. And as mentioned, her cerebral and renal NIRS have been downtrending, but have been around the 60s to 80s. My assessment is that she's generally comfortably awake, intubated, appropriately sedated, but well appearing and no acute distress. From a CV standpoint, as mentioned, she's been tachycardic in the 160s with a normal rhythm. I did appreciate a continuous murmur at the left upper sternal border. She's warm pink, well perfused with a cap refill in all extremities of around 2 seconds. And pressures have been in the 60s to 80s over 50s. She's on a continuous milrinone infusion to support her cardiac output prior to her Norwood procedure at 0.7 mics per kilo per minute. From a respiratory standpoint, she's tachypnic at baseline with symmetrical chest expansion. There's a healed midline sternotomy scar that is dry and no drainage. Her lungs have been clear bilaterally with no wheezing or retractions noted. She's on a high flow nasal cannula at 6 liters per minute at 30% FiO2, and her oxygen saturations have been in the 80s. Her goal is about 75 to 85. Her chest x-ray today looked good and was unremarkable. From an FENGI standpoint, she's tolerating advancement of her continuous NG feeds of 24 cal NeoSure at 75 mLs every 3 hours. Her abdomen's soft, non-distended, regular soft bowel movements. Her liver edge, I was able to palpate about 1 centimeter below the right costal margin. Her Lasix strip for diuresis is at 1 milligram, or she's not on drip, I apologize. Her Lasix is 1 mg per kg. She gets that about every 12 hours. She was positive 65 this morning. Her BUN and creatinine have been normal. She gets sodium chloride supplements, 1 MEQ per kilo, and Terralate every 24 hours. Her last sodium level 2 days ago was 141, and she's also on a daily multivitamin. For heme, she gets a daily aspirin, 20.25 milligrams. ID, I don't have any concerns. She's been afebrile. Neuro, she's not agitated. She's alert, equal strength and tone in all of extremities. Her agitation has been adequately managed with the clonidine at 14 mics every 6 hours, gabapentin 5 milligrams 3 times a day. She gets melatonin at night, 0.4 milligrams, and Ativan PRN, which she has not used for over a week. Her skin, no rashes and no concerns. So my impression is AG is a 7-week-old female with a complex cardiac history, as I mentioned up above. Status post-hybrid. She's awaiting her neuro procedure, which is scheduled for next week. We're optimizing her nutrition and supporting her cardiac output with high-flow oxygen and milrinone drip. Problem list, we have health maintenance, complex congenital heart disease of a DTGA, VSD, hypoplastic aortic arch, currently unrepaired. And for differentials, an unrepaired complex cardiac lesion with pulmonary overcirculation based on her current heart anatomy. So plan by systems. For CV, we're going to continue the milrinone drip of 0.7 mics per kilo per minute to optimize her cardiac output and decrease the diastolic dysfunction and afterload until surgery. Continue to monitor her cerebral and renal nears and maintain normal blood pressures. From a respiratory standpoint, we're going to continue the high flow nasal oxygen at 6 liters per minute with 30% FiO2 with oxygen saturations anywhere from 75 to 85. We'll get a chest x-ray on Monday prior to surgery. For FENGI, we're going to continue her NG feeds, which are currently at goal with the 24 cal NeoSure at 75 mLs Q3. We're going to continue the Lasix scheduled at 1 mg per kilo enterally for routine diuresis. We're going to get daily weights, continue the daily multivitamin, and we will also decrease our sodium chloride supplements to 1 MEQ per kilo enterally every 24 hours and also recheck a sodium level today since we haven't in 2 days. We're going to obtain BMPs on Mondays and Thursdays. For heme, for her anticoagulation, we're going to hold the aspirin beginning today prior to surgery. For neuro, we're going to continue the clonidine as scheduled at 40 mics every 6 hours. For gabapentin, we're going to continue as well at 5 milligrams TID. And melatonin every night, 0.4 milligrams. We're going to discontinue the Ativan since she has not required it in over a week. And for her lines, she has a single lumen right lower extremity pick, which we are going to keep for lab draws and medications and upcoming surgery.